Okay, this video is on core activation, not necessarily strengthening, but just activation and body awareness and ergonomics dynamics. Okay, so the first thing that you need to be aware of with low back pain is how to both sit and bend over and walk without putting basically extra strain on your vertebrae. If like this is your whole spine, the whole thing can bend and kind of take the force across the whole thing. Or you can imagine if it's like this, there's a lot of pressure in this one spot. So the first thing I want to just bring your awareness to, and this is simple, but I'm so guilty of this. I've had low back pain issues in the past. And these things I'm going to show you in this video are actually are key. They're key to how I was able to start improving my pain on my own. So this is about both posture standing while you're standing and how you bend over or not bend over, how you pick something up. The low back here, essentially, like I was showing with my finger, like if you do this and push the back out, you're creating a lot of pressure. I mean, I can feel this in my low back right now. I'm getting a lot of pressure right here. So it's such a tendency for me and I watch people sometimes, around because I do this stuff, so I'm curious to sort of see how people use their bodies. And it's so easy to pick something up and do this. No, that's a no-no. Look at my back. Look at that big hump when I bend over like that. So I can feel this when I bend over like this, and my back muscles are a little overdeveloped actually down here, so it's a little bit more pronounced in me. But when you bend over like this, there's so much pressure right there. So what I want you to think about, both when you're standing and if you're going to bend over to pick something up, is your pelvic tilt. So if you feel your hips like this, you can roll your hips forward, makes your belly stick out, kind of makes all this relax. Makes a big divot here, and then roll back. So I want you to just do that a few times. Roll forward, roll back, and it's just building awareness, okay, of pelvic tilt, of the way that your pelvis is tilted. And so what you want to do is kind of find where's neutral in the middle. If you are too far this way, it puts pressure on the spine and actually makes these muscles more weak, which are part of your core. You want to be neutral like this. You likewise don't want to be like this. This is much less common of an issue to be like this. So just practice like this. Find what's neutral. Okay? And so when you're standing and walking, that's body awareness step number 1, is keeping your pelvic tilt sort of in the middle, balanced, so that there's not undue pressure on your low back. Okay? Now, if you're going to bend over, I want to show you something. So when I bend over like the way I showed you not to, like this, okay, that's a lot of pressure. But notice I'm going to roll my pelvis forward while I'm bent over like this. Look how my back straightens out. So here's just like bending over sort of sloppy. Pelvis rolling forward. Now when I do that, I have tons of stretch in my hamstrings and my calves now all of a sudden. So what it looks like if I'm doing it mindfully, it's like, okay, if I'm going to bend over and get that thing, I'm going to keep my pelvis rolled forward, and it more looks like this. Now, my hamstrings are super tight. This is actually about as far as I can go like that. So what you do, you bend your knees. But look, I'm keeping my back straight because I'm rolling my pelvis forward. So basically being mindful and not just willy-nilly like doing this and picking something up, because if you have back problems, and you may know this, you can throw your back out doing that, especially if you bend over to pick something up that's of any weight doing that. The other easy thing is to squat down, right? Now, if it's not, it may not be easy for your body. I shouldn't say like the easy thing to do, because I know it's not always easy for everybody, but it's something you can work on. So one of the things that can help you get stronger to be able to squat down like that is one of the core activation things, actually. So before I show you that, let me just talk about what I mean by the core. So your core is just a bunch of different muscles that basically involve your pelvis and your lower abdomen, maybe some of your torso. So all of the abdominal muscles, as well as all of the ab muscles that go around the side here. And a lot of it is the butt muscles that are kind of like around your hip, the glute muscles, and then the big ones are in your pelvis. So the muscles that are in your pelvis are the ones that when you're trying to stop having a bowel movement or stop yourself from urinating, or if you're trying to hold that, those are the muscles that are actually in your pelvis that are contracting and flexing down. So those muscles all contribute to basically the stability of your low back. So it helps if they're strong, but for a lot of us, before we even work on strengthening them, we just need to activate them, okay? So I want you to do this exercise with me. Sit down, and this is really important. This is another body awareness thing. You have to be aware of these pelvic muscles, but this is super important for anybody who's driving a lot, sitting a lot at a computer, truckers, okay, anybody with low back issues that is having to sit a lot. You can help greatly by just throughout the day bringing your awareness to the pelvic floor muscles and activating them. So when you're sitting, when you sit up kind of straight, roll your pelvis so that it feels like your back's kind of straight. So that's like step number one. If you sit for very long, you'll know that you're activating some of the core muscles to hold your back straight, even because it gets tiring. It's easy to just slouch down and sort of dump into your low back. Roll the pelvis forward, get your back straight. And now what I want you to do is we're going to bring awareness to the pelvic floor muscles. So you're going to squeeze, like 50% or something, the muscles like you're trying to stop yourself from having a bowel movement or urinating, okay? Anybody who's done Kegels, like this is kind of the basis of Kegels, but we're not trying to strengthen them. I just want to bring your awareness. So hold the contraction, then relax it. Hold the contraction a little bit, relax it, and do it a few more times. Okay, just bring in awareness. Now, what I want you to do throughout your day, if you're sitting a lot, is to, number one, ask yourself, check in, how straight is my lower back? Am I sort of dumping down into it, letting it relax like that? Can I roll my pelvis forward and straighten it up a little bit? Now I understand that there's lumbar support and things, and they help your back feel better, right? Because the tendency is for your back to do this when you're getting tired and sitting a long time, and so then you put a support there. But when you think about it, you're basically like you're supporting yourself, but you're just contributing to all of the muscles becoming weaker and less activated because you're just using a brace. So I'm not saying never use that, but try to move away from the lumbar support stuff and just push the edge of how long can I keep my back straight without that lumbar support. That's activating the muscles and actually strengthening them over time. So that's number one. How's my back right now? Is my lower back straight? Then bring your awareness to those core muscles, the pelvic floor muscles. And what I want you to do is just 20% or something, just contract those muscles. Something that's like very minimal, you just notice it a tiny bit, it's not fatiguing to really hold that. And if you're able to be aware, just kind of like relax them all the way. Notice your back, how it feels. Like you can actually feel it in your low back if you're very body aware, body sensitive. The little bit of contraction. So throughout the day, how's my lower back? Is it straight while I'm sitting? Can I hold just a tiny bit of tension in my pelvic floor? Just a little bit of activation. And that goes a long way. And it doesn't actually take that long of just bringing your awareness to it over and over, like definitely over a couple weeks or a month. Like that's going to really be a contributing factor to having decreased pain because of more stability, essentially. Another thing you can do, a visualization you can do to keep your back straight, is just picture a thread the top of your head, and just, so you're not even putting the awareness on your low back, but this thread's pulling up, so it's kind of like, imagine the string pulling from the top of your head, and it's sort of interesting because when you do that, it's like, whoop, string's pulling me up, and your back automatically goes straight. So that's just a visualization, but that's, I really can't overemphasize how important that is if you're sitting much during your day. So the other thing that I was mentioning about bending, instead of bending over, squatting, if you need to work on being able to do that, one of the things you can do are wall sits, and this is also a way that you can do this each day as a way to start to activate and strengthen your pelvic floor and core muscles as well. So I'm going to do it on the wall over here. All you're doing is you're putting your back against the wall, feet out like a little bit. You don't want your heels against the wall necessarily. I got to move mine out a little bit more here. And you're just squatting down. So if that's, you ideally want to get down to 90 degrees with your legs and your knees, but if you can't do that, then just go where you can go. So this is about 45 degrees for me right now. But as I'm doing this, I'm still engaging my pelvic floor. But you can start going down and do these wall squats for, you can go till it burns in your legs. Do good, like 20 seconds, 30 seconds if you can. Longer is great. You're just gonna get stronger, but do this every day, multiple times, at least do series of 3 in each setting, but like three of these, twice a day is a good place to start. And I'm engaging my pelvic floor right now, and you can see I've done this quite a bit, so I can stay here while I'm talking to you, and it's not too big of a problem. So you can get strong pretty quick doing that. Okay, so just to recap before I show you the last couple of things that I want you to do each day, we're going to first become aware of our pelvic tilt. We're going to become aware of when we're bending over to pick something up, what is our pelvic tilt like? What's the arch in our low back? Are we arching? It needs to be flat. And bend your knees as you're bending over to support that, because most of us aren't flexible enough to keep our back straight and bend all the way over and put our hands on the floor. And then after that, we talked about just activating the core and the pelvic floor muscles when we're sitting, and keeping the back straight when we're sitting, and getting away from lumbar support stuff as much as we can. So next I want to show you some things that you can do that not only activate some of your core muscles, but will strengthen them. And you can do this. I want you to do this every day as a practice. It doesn't take long, but you can do this like if you're in back pain and it's a functional sort of thing, there's a good chance this will help in the moment. When I've had back issues in the past, doing these core activating exercises, it's noticeably different. I noticeably had less pain when I would do these things because it's that important for our stability. So this is a yoga block. You can use anything for what I'm going to show you. Anything, basically you're holding it between your knees. So you're like this. What we're going to do, I'll do it without the block first. We're just putting our feet flat and we're just lifting our pelvis up. It's nice to be able to lift and have kind of a straight line. As I'm doing this, all of these muscles, the glute muscles as well as the low back muscles, they're all engaged right now. And using those muscles to hold myself up, basically. So you hold this for, again, I would hold at least 20 or 30 seconds, but go until you're feeling fatigued. Do series of 3. So every day you're going to practice this. You're just going to lay on the ground, hold this. Okay. You can even, if you're feeling really strong doing that, an advanced thing that you can do is when you're up here like this, hold this, and then see what it's like to lift a leg up, but also keep straight like this. So that's a lot on one leg. Now be mindful when you're doing this, is is your pelvic floor actually activated? Because you can still have your pelvic floor relaxed while you do this, but it'll help if you just activate that a tiny bit while you're doing this. Drop my block. So the other thing that I was going to show you is if you take the block and put it between your knees, same thing. In yoga, this is bridge pose, but holding it between your knees just makes you have some inward pressure, okay? Okay, so we'll do that. Really trying to do that, that's not easy. Okay, those make a big difference. Other thing you can do is you can have both legs up, 60, 30, 1 inch. You can lay one down and do it. And I can feel all this in my low back with the muscles engaging and everything. And it doesn't take long. If you do this every day, at least once, series of 3 of them, I'm pretty confident that you will start to notice a difference as long as there's not some major structural issue. The last thing I want to show you, which is sometimes a kind of a miracle how much it can help, is called a pelvic balancing. Usually I do this with 2 people, but I don't have anyone else here, so I'll show you. So I'm putting this between my legs, and I'm squeezing it right now. About 30 to 50%, squeezing my knees in and squeezing this block. And so it's activating all the muscles on the insides of my legs, and actually made my symphysis pubis crack, which sometimes happens. So you hold that for about 10 seconds. You're not trying to strengthen it, you're just activating it. The part that's easier to have a person is you then put your knees out. So squeezing in with my legs, and then just want to pull out. So if you have a person, they hold your legs. When I'm by myself, I'll use a strap. Sometimes I can do this, and it works okay. So I'm squeezing out right now. So you just do a series of 3, holding for 10 seconds, squeezing your knees in and squeezing out. And all it's doing is using the muscles around your core and your pelvis to bring your pelvis into balance, basically. And if that's a major contributor to your back pain, that will really help. So, all right, I'm going to recap here, and I'll put this I'll put the sort of 1, 2, 3, 4 of the routine that I want you to do every day. So recapping what I'm showing you for the core piece is doing wall sits to get your legs strong to be able to squat, as well as activating your core when you're squatting on the wall. Doing that for at least 30 seconds, three times, twice a day would be great. The next thing I want you to do is the things that I was doing on the table. Okay, so the bridge pose with the hips up. Maybe you lift one leg, that's a little bit advanced. At least the hips up. Again, doing that for 30 seconds at least, whatever feels comfortable, 3 times. And then you can hold something between your legs. Do the pelvic balancing thing too, at least once a day, where you're squeezing in and pushing out. Okay, these are just the fundamental core things that I've found for myself and for my patients to be helpful. So regardless of why you have back pain, none of that should be contraindicated. Okay, there shouldn't be a reason that you can't do any of that. And even when there's real structural issues, this and all the other things I'm going to talk about still help, even if they aren't the thing that can address the full issue. All right, try that. Leave comments if you have any questions. Happy to answer them.